future generations are going to be paying for this program. You condemn my nieces and nephews, my entire family, your all entire family, to a tremendously lower rate of standard of living where you will not be able to afford your choices. I haven't heard any discussion in this medical bill about personal liberty and how that's going to be affected. Because this country is built on life, liberty, and the pursuit of happiness. Unfortunately, life is not always fair. And I've had conditions in my family, as everybody else has as they go through life. And you deal with them. You play the hand you're dealt. But at some point, the chips are all on the table, and responsible people have to pay for this. And there hasn't been responsible people on both parties up in Washington willing to deal with the 56 trillion, not billion, trillion in deficits and liabilities we already have. Now, a trillion is a hard number. I had somebody tell me the other day we were talking about it, and they said, well, a trillion, it's a non-number, it doesn't mean anything. Well, it does when you put a dollar sign in front of it. If you take a trillion seconds ago, was over 38,000 years ago. And we're 56 trillion in liabilities already. So my question is, when does it stop? When do we have some common sense coming out of Washington that has a reasonable idea to pay for these things? Because it's ridiculous. You're going to condemn the future of this country to mediocrity, and there's a reason we don't have national health care, because it doesn't work in other countries. That's why they come here. I'm not done yet, sir.
Yeah,
I'm not done yet.
Please finish. I'd like to answer your question.
There's a reason it hasn't been done since Truman. It's because it's a bad idea and it doesn't work. Thank you.
Thank you for your thoughts. I want to mention, I guess, and reiterate what I said earlier about the healthcare cost trajectory that we're on right now. That healthcare costs are the number one reason for bankruptcies in America. It is struggling. Small businesses are struggling, families are struggling, and if we continue on this course, by 2035, a fully 1/3 of our GDP is going to be spent on healthcare. So, I guess the first and most obvious thing is we can't afford the broken system that we have. So the approach that has been proposed, actually half of that is done by savings and actually going after, there are new provisions in this bill to go after waste, fraud, and abuse in the system. That obviously is an important part of savings, and also that we are looking at small increases for the wealthiest 1.2% of Americans to pay for the rest. So it is a balanced approach, and I want to ask Andrea Ruth to follow up as well.
Thank you, Congressman. I represent about 40 consumer advocacy groups throughout the state with the Missouri Health Advocacy Alliance. And what I want you to know is this is not an easy issue, and we're hearing that today. There are people who think the bill goes too far. There are people who think the bill doesn't go far enough. There are people who think we should let the private marketplace work this out. That hasn't worked until this point, as we know, because we see the results of it here. We have almost 46 million people in our country without insurance.
That's not true.
We have many people who are underinsured in our country. They're spending over 10% of their income on their insurance premiums, their deductibles, their co-pays, and their out-of-pocket costs for things like prescription drugs. And, Congressman Carnahan's father and many legislators dealt with this issue in Missouri in the early 90s. And I can tell you that I wish there would have been this many people in the room when we were talking about that. We got to do something about this problem, and the number of people in this room are a true indication of why we need to do that. You know there's a problem. We can't just continue on the way we are. $35 trillion. We're going to spend $35 trillion on healthcare over the next 10 years anyway, whether we do something about this or not. This is an attempt to try to cut those costs, to try to find a way to make this system work for people. So, you know, I want to, on behalf of many consumers in this state, I want to thank the congressman and all of Congress for trying to work this out and trying to find a bipartisan agreement on this. You know, there's consensus around a lot of issues in this legislation that there's never been consensus around. Now there is consensus around the Medicaid expansion up to 133%. That's going to cover a lot of uninsured in our state. As Amy Bluen said, in Missouri, we only cover adults up to 17% of poverty on Medicaid, and that's adults with children. We don't even look at single adults who might be without coverage. So this bill's going to address that, and there's consensus around that. There's consensus around the affordability provisions and trying to provide some subsidies for people in the middle class. There's a lot of agreement around some very significant pieces of this bill, but I can tell you that there's also a lot of people who don't want anything to happen. The status quo is just fine for them. And most of those people, for them, it's fine because they have coverage. They have access to care. So I would suggest that for those of you who are concerned about Congress moving forward with this, that you consider what's the alternative. And if you have some options to put on the table, it sounds to me like people are open to hearing those plans and options for how we're going to address a broken system. The last thing I wanted to say, thank you for the microphone, is that you know, a bipartisan plan, a bipartisan supported plan would really be helpful. In the 90s, when I worked on healthcare reform, there was some significant progress made in Missouri around access and Medicaid and people having access to care. A lot of that was undone when politics changed and different people came into power in Missouri. The beauty of a bipartisan supported bill is that it might actually last long enough for us to see if it works. So I really hope that there is a bipartisan supported bill, and I know that there were a lot of amendments put on this House bill that were actually Republican amendments that got passed and put on the bill. And I think that's promising for all of us. Thank you.
Andrea and I have gotten used to tag teaming, I think, across the state, so we know what each other is going to say. And one of the things that I just wanted to add to what she said is that we know the importance of keeping the federal deficit from growing. And the Congress knows the importance of doing that as well. That's why this bill is budget neutral. That's why they're building in the revenue for this bill. And Congress is taking that very seriously. This is not going to grow the deficit. The other piece of this that I want to reiterate very clearly is that without fixing health care, we cannot fix our economy. We cannot grow jobs. Our small businesses, large businesses, every profit that they're able to squeeze out each year has to go in to turn around and be used the next year just to maintain their benefits for their employees, their health benefits, if they can. We have got to address this if we want to be able to pursue the American prosperity that we're known for. Okay? We have to address this.
Thank you. I'm going to